Okay, hi, my name's JC. I'm going to be doing my IV start video. So throughout my entire school, I'm going to maintain my GPSP. I'm going to do my 11 medication rights. I'm going to do my 3 med checks. I'm going to check for any allergies, and I'm going to use my 2 patient identifiers. So now to begin, I'm going to start with my IV bag. I'm going to get it ready. I'm going to spike my IV bag, and I'm going to make sure I maintain my asepsis through this entire thing while I'm preparing the bag. And I'm just going to go in with a push. And this is my IV bowl. So now I'm going to hang my bag. I'm going to fill my chamber halfway full. And now I'm going to prime my bag. So I'm going to remove this cap. And I'm not going to touch it to anything. And now I'm just priming my bag, making sure there's no kinks in my line and there's no bubbles. Now I'm going to close my clamp. And I'm going to put my cap back on. And I'm going to make sure, like I said, I'm maintaining my asepsis throughout this, getting my bag ready. Okay, now I'm going to go ahead, I'm going to get this out of my way. I'm going to start for my IV. We're just going to go ahead and get our J-loop out. And my saline. I'm going to prime my J-loop. Make sure there's no bubbles. Put my cap back on. And then I'm just going to make sure. I'm going to put this back in my bag, making sure not to contaminate anything. So now I'm going to get ready to do my IV. For my IV, I'm going to just go ahead and I'm palpating for a viable vein. I want to make sure that I ask the patient if they have an arm they prefer or a site, and check that and see if I could use that. But now I'm going to apply my tourniquet. Actually, Jake, could you let me put this on you so I can show them, because it's a little bit hard to put it on here. So I'm going to put my tourniquet on. Sorry, I don't want to put it too tight, just to show. And then I'm just looking for a vein. I'm going to check the radial pulse. That was good. So, thank you, Jake. But so now I would do that first. I'm going to do it and check for my vein. I'm going to let it go. And now I'm going to go ahead and get my stuff ready to do my IV. So I'm going to open my needle. Okay, now I'm going to perform hand hygiene. I'm going to put my gloves on. At this point, I would have gone ahead, I'm gonna put my tourniquet back on. You want it 3 to 4 inches above the site that you're using, but it's, like I said, it's kind of hard to put it on here. I'm gonna get my stuff ready. Now with gloves, we'll see how this goes. Gonna just have that ready. I have my tourniquet on. I'm checking the radial pulse again. Now I'm going in and I'm gonna clean for 60 seconds. Cleaning the site for 60 seconds. And I'm gonna let it dry. This is my trash over here. So I'm gonna dispose of this. And so I'm gonna let that dry. Now I'm gonna get ready to So now I'm going in at a 10 to 15 degree angle. Oh, I'm sorry. In real life, I wouldn't do this, but we've been practicing with these, the catheters get kind of funky. So I'm gonna go in at a 10 to 15 degree angle. Then I'm going to make sure there's blood return, and then I'm going to advance my catheter. There's blood return. I'm going to undo my tourniquet. I'm going to stabilize my catheter, making sure not to contaminate the site. And I'm going to put the safety on my needle. And that's my sharp, sorry. And now I'm going to get my tape, maybe. Should I put it on my other hand? And I'm going to make sure not to contaminate the site. And I'm going to tape down my catheter. These gloves make it a little bit difficult to get this tape down, and this thing doesn't want to stick, or let the tape stick. And you just want to make sure you're stabilizing the catheter during that. And now I'm going to go ahead, and since that's good, I'm going to go ahead and get my J-loop. And this is already primed. I'm getting a clean alcohol pad, and I'm gonna clean the catheter hub. And just in case, I'm gonna get another clean alcohol pad. I'll just go ahead and wipe this just in case. Should be clean, but just in case. Oh, these gloves make it a little bit. And then just making sure I don't touch the site. I'm just attaching the J-loop to the catheter. And then you're just gonna go ahead and flush with the rest of, well, first you're gonna aspirate, and then you're gonna flush with the rest of the 10 milliliters of saline. And while you're doing this, you're just making sure that there's no complications with the site during your flush. So now I can go ahead and take this off. Just dispose of it properly. And then I'm going to get my and again, I'm making sure not to touch the site. I'm gonna get my Tegaderm. It's kind of hard to put it on here for this because, like I said, nothing wants to stick to this. And it's kind of small, so it all ends up coming together. And then I'm going to dispose of that. And then I'm going to go ahead and I'm going to label this. Maybe. I'm going to label this according to facility policy, and I'm going to do date, time, location, needle gauge, and I'm going to do my initials. Now I'm going to go ahead and I will get another clean alcohol pad, and I'm going to get ready to attach it to my IV. I'm going to dispose of this. I'll get another clean alcohol pad, and I'm just going to make sure I clean just in case. And I'll get another clean one. And you want to make sure, like I said, we're maintaining asepsis throughout our entire skull. And you want to attach it. Okay, now gonna unclamp my line. I'm gonna set it for the facility. I'm gonna set the flow to whatever has been ordered, or the flow rate for whatever's been ordered. And I'm gonna just go ahead and I'm gonna check the patients, evaluate for any signs of infiltration, and I'm gonna come back and I'm gonna check their response and just assess to make sure that there's no issues with the IV. And then we're just gonna report and record. Thank you. Oh, and I'll take my gloves off and perform hand hygiene, obviously. But thank you.